Welcome to the DoubleACS Daily News. While the COVID vaccine is rolling out, testing has become more widely available. We spoke with a representative from Sturdy Memorial Hospital to get an update on how the testing process works.
My name is Dr. Antonella Fine, and I am an infectious diseases physician, and I am the Director of Infection Control and Antimicrobial Stewardship at Sturdy Memorial Hospital here in Attleboro, Massachusetts. I trained nearby in Rhode Island at Brown University, and I've been at Sturdy Memorial Hospital for a little over 4 years. And I am also the co-chair of the COVID-19 task force at Sturdy Memorial Hospital and leading the Sturdy affiliates in the region, along with Dr. Brian Patel, who is our head of emergency management services.
If someone doesn't have insurance, has a hard time getting a referral, looking at Attleboro's homeless population, what is the plan?
So in our region, for anyone who has insurance and has a Sturdy medical provider, you can come to our drive-through testing site with an appointment, and the test is completely free. It's covered by insurance. For people who do not have insurance but might still have a Sturdy medical provider, again, they can still get tested at our drive-through clinic here at Sturdy, and the test would be free of charge. For those who neither have a Sturdy provider nor have health insurance, there are many, many locations, in fact, hundreds of them in the state of Massachusetts. If you go to the Massachusetts Department of Public Health website, there is a complete list in a PDF form and even map form of all of the testing sites that are available in Massachusetts. The closest location that's doing testing outside of the Sturdy system to our area is Convenient MD, but there are many, many, many test sites. So I don't want people to think that they don't have options if they can't get tested at Sturdy, that that's not worth getting tested because they have to go far. They really don't have to go far. There are many test sites that are available. And what I've heard is that the turnaround time for those test sites are usually somewhere between 3 and 5 days for a result. So if you've been exposed to COVID-19 and you're trying to decide, do other members of your family need to get tested? It's important that you know whether or not you are ill yourself. If someone is diagnosed with COVID-19 in a home, what they should try to do, if possible, is to wear a mask at all times when they are within 6 feet of other members of their household. So try to eat in a separate area, brush your teeth in a separate area with the door closed, and isolate yourself from other people. And even when wearing your mask, try not to be spending too much time in close proximity to other people in your household. It can be isolating and sad, but we won't be able to get through this pandemic if we don't, sacrifice for a couple of weeks to try to minimize transmission to other people, particularly if we know that we have members of our household who have comorbidities or are of age 65 or older that place them at high risk for severe disease, hospitalization, and death from COVID-19. So if there's a separate bathroom in the household or a separate bedroom, the recommendation would be to try to reserve those for the person who's infected so that they can remain separate from other members of their household. And I want to define really the difference between isolation and quarantine. Isolation is for people who have been infected and diagnosed with COVID-19 infection. Quarantine is for people who have been exposed to COVID-19, but they have not yet been diagnosed with COVID-19 infection themselves. So isolation, that's where the masking is important. For quarantine, it's still important that the person who is exposed wear a mask and try to isolate themselves as much as possible too, because they may develop COVID-19 infection with or without symptoms and not be aware of it during their 14-day quarantine period. So it's a nuance between those two words, quarantine and isolation, but in the end reality is that there really should be separation from that person as much as possible to other members of their household. And the key is that person should not be leaving their home. So they should try having food delivered to them or have someone who's healthy go to the supermarket and bring them supplies that they might need. The only reason they should be leaving their household during their quarantine or isolation period should be to attend a medically necessary medical visit where a provider has told them that they have to come in to get a medical test.